Assalamualaikum warahmatullahi wabarakatuh. I am Fatin Safia. So today my group mates and me will be presenting about the infection of hepatobiliary system. My two other group mates is Amira Fiki and Saidatul Najla. Now let us see the introduction for hepatobiliary system. So hepatobiliary system consists of three components with three organs, which is liver, gallbladder, and also bile ducts. So liver will produce bile and performs metabolic and detoxification functions, while gallbladder will stores and concentrates bile, and bile duct transport bile from the liver and gallbladder to the small intestine. So based on the picture here, this is where the liver located, and then gallbladder and also the bile duct. Okay, so bile duct is what will be highlight in this presentation. Hepatobiliary infection is actually referred to the infection which affect the liver, gallbladder, or biliary tract. And these infections usually occur when bacteria invade the biliary system due to biliary obstruction or through ascending infection from the gastrointestinal tract. So among the hepatobiliary infections, acute cholangitis is the most common one. So acute cholangitis, also known as ascending cholangitis, it is a potentially life-threatening infection of the bile duct, and it usually occurs when there is obstruction of the bile flow due to the choledocholithiasis, which is the presence of the stones in the common bile duct. So there is actually two major causative microorganisms that cause acute cholangitis, which is the Escherichia coli, or usually called E. coli, and also Klebsiella pneumonia. Okay, now so before we go deeper to the microorganism that cause this disease, let us see the risk factors for the acute cholangitis. So several conditions can increase a person's risk of developing this infection. First is diabetes mellitus. Patients with diabetes will often have impaired immune function, so they are more susceptible to the bacterial infection, including infection of the biliary tract itself. And the second is biliary strictures or tumors, which can narrow or obstruct the bile duct. This causes bile stasis, which creates a favorable environment for bacterial growth and infection. Another important risk factor is biliary instrumentation, such as endoscopic retrograde cholangiopancreatography, or ERCP. Although ERCP is useful diagnostic and therapeutic procedure, it also may introduce bacteria into the biliary system. Lastly, immunosuppression increases susceptibility to acute cholangitis because patients with weakened immune system, such as those receiving chemotherapy, organ transplant recipients, or individuals with chronic illness, have a reduced ability to fight off any infections. Next, we will look at the epidemiology of the acute cholangitis. Acute cholangitis accounts for fewer than 200,000 cases per year in the United States, making it a relatively uncommon but clinically significant disease. The condition most commonly will affect the individuals between the ages of 50 and 60 years, mainly because the risk of gallstone formation increases with age. So in terms of gender distribution, acute cholangitis occurs at a similar rate in both males and females, showing that no significant sex predominance. So among patients who are hospitalized with gallstone disease, approximately 6 to 9% may develop acute cholangitis as a complication. In addition, certain populations are at higher risk of developing this condition, including individuals with gallstone parasitic infection and also sickle cell disease. Okay, so first, E. coli is a gram-negative bacillus that normally exists as a commensal bacterium in the gastrointestinal tract, particularly in the colon and distal intestine. E. coli possess fimbriae, which usually will help the bacteria to adhere to the epithelial surfaces, and lipopolysaccharide, or LPS endotoxin, usually will contribute to the inflammation and also disease severity. Next is the second major pathogen, which is Klebsiella pneumonia. So this is the second major pathogen for the acute cholangitis. Similar to E. coli, it is also a gram-negative bacillus and part of the normal intestinal microbiota. Its important virulent factors include a polysaccharide capsule, which will protect the bacterium from phagocytosis, as well as fimbriae and also LPS endotoxin that will facilitate colonization and also inflammation. Okay, so besides E. coli and Klebsiella pneumonia, several other microorganisms also can cause acute cholangitis. These include the Enterococcus species, Streptococcus, Enterobacter, and also Pseudomonas aeruginosa. These organisms often part of the normal gastrointestinal flora, but also become pathogenic when there is biliary obstruction and bile stasis occur. As in this table, there is a few details about it, which you guys can read later.
Moving on to the pathogenesis, this flowchart shows how a bacterial hepatobiliary infection develops. First, the process usually begins with a gallstone causing biliary obstruction. As a result, bile cannot flow normally through the biliary tract, leading to bile stasis. Next, the stagnant bile creates a favorable environment for bacterial growth. Intestinal bacteria can then ascend from the duodenum into the bile ducts. The most common causative organism is E. coli, a gram-negative root that normally lives in the intestinal tract. Once E. coli enters the biliary tract, it colonizes and multiplies within the stagnant bile. In addition, the bacteria produce virulence factors such as adasin, which help them attach to the biliary epithelium, and endotoxin, which trigger inflammation. As the bacterial population increases, acute cholangitis develops. At this stage, the inflammatory response damages the bile duct and surrounding tissues. So if the infection is not treated promptly, the bacteria may spread beyond the bile ducts into the liver tissue. Consequently, continued bacterial multiplication and tissue destruction can occur. Finally, this may lead to formation of a liver abscess, which is a localized collection of pus within the liver. In summary, E. coli plays a major role in the development and progression of hepatobiliary infections, particularly in patients with biliary obstruction and bile stasis. Next, the clinical manifestation. One of the classic clinical manifestations of acute cholangitis is Charcot-Striate, which consists of fever, jaundice, and right upper quadrant pain. Fevers occur as a result of the body's inflammatory response to bacterial infection, most commonly caused by E. coli and other enteric bacteria, while jaundice develops when biliary obstruction prevents the normal flow of bile, leading to the accumulation of bilirubin in the blood. Right upper quadrant pain occurs due to the inflammation and increased pressure within the infected bile ducts. In severe cases, acute cholangitis may progress to renal splantate. This includes all three features of Charcot-Striate together with shock and altered mental status. Shock occurs when bacteria or their endotoxin enter the bloodstream, causing sepsis and a significant drop in blood pressure. Meanwhile, altered mental status, such as confusion or reduced consciousness, may develop due to poor tissue perfusion and systemic infection. Next, I will discuss the investigation used to diagnose hepatobiliary infections. First, blood investigations are performed. A complete blood count often shows leukocytosis, which indicate the presence of an ongoing bacterial infection. In addition, liver function tests are usually abnormal. Bilirubin levels may be increased due to biliary obstruction, while ALP and GGT levels are elevated as markers of cholestasis. AST and ALT may also be elevated, reflecting inflammation and damage to liver cells. Next, microbiological investigations are carried out to identify the causative organism. Blood culture is one of the most important tests because bacteria may enter the bloodstream during infection. If a bile sample is available, a bile culture can also be performed to isolate the pathogen directly from the biliary tract. Following culture, gram staining provides a rapid preliminary identification of the bacteria. E. coli appears as gram-negative bacilli, seen as pink root-shaped bacteria under microscope. Similarly, Klebsiella pneumoniae also appears as gram-negative bacilli, but is often distinguished by its prominent capsule. To further confirm the identity of the organism, biochemical identification tests are performed. Finally, PCR may be used in some laboratories for rapid and sensitive detection of bacterial pathogen.
Now proceed with treatment and management of acute cholangitis. Immediately after discovering the disease, IV fluid resuscitation and broad-spectrum antibiotics are to be given. Supportive care is also to be given and to monitor the patient's condition. After the patient has stabilized, endoscopic retrograde cholangiopancreatography or percutaneous transhepatic biliary drainage is recommended. If both fails, surgical drainage is recommended. Next is the prevention of acute cholangitis. Acute cholangitis is caused by gallstone obstructing the bile flow. So the recommended thing to do is early gallstone treatment if it is found that there's gallstone inside the gallbladder. There's also control of underlying conditions. For example, if patients have diabetes or they have immunodeficiency. It is also recommended to practice proper hygiene control to prevent infections and proper nutritional intake to reduce gallstone formation, and also regular exercise to dissolve gallstones. Integration of akli and nakli. Ibn Abbas reported, the Prophet, peace and blessings be upon him, said, there are two blessings with which many people waste health and free time. Now, how does this correlate with acute cholangitis? Well, acute cholangitis, as said before in the pathogenesis, is caused by gallstone formation blocking the bile flow. So, exercise and physical activity actually enhances cholecystokinin production. Cholecystokinin helps with bile flow, and with the flow of increased flow of bile, chances of gallstone formation and bile duct obstruction is reduced. Miqdam bin Madi Karib said, I heard the Messenger of Allah sallallahu said, a human being feels no worse vessel than his stomach. It is sufficient for a human to eat a few mouthfuls to keep his mind straight. But if he must fill it, then 1/3 of food, 1/3 of drink, and 1/3 of air. Now, how do we interpret this and correlate with acute cholangitis? So, gallstone formation increases with increased cholesterol in the human body. So, as the Prophet said, eat less to keep your spine straight, to keep the body from being obese. Why? Because obesity causes increased gallstone formation. So, in conclusion, the hepatobiliary infections affect the liver and the biliary system, which is the bile duct and the gallbladder. E. coli and Klebsiella are the main pathogens that cause acute cholangitis. Early diagnosis and treatment helps reduce the complications of acute cholangitis, and prevention and Islamic health practices are important to reduce the formation of gallstones.